Good afternoon, one and all. I'm Dr. RAHUL GOGINENI, second year postgraduate, and it's an honor to be presenting on this stage. So my topic is muscle transplantation cures adult onset comitant large exotropia with diplopia, which is an infrequent entity corrected by novel surgery. So large angle alternate exotropia is exotropia with more than 70 to 75 prism diopters of deviation, and the finding of diplopia associated is a rare finding, but it was seen in this case. So a 31-year-old male patient presented to our department with outward on and off deviation of right eye since 15 years. And he complained of diplopia since 2 years, which worsened since past 7 months. And the diplopia is binocular in nature and nocturnal variation was not seen. He had trauma to his right-sided forehead 16 years ago. So these were his photographs at age 7, 27, and at the time of presentation. So he had a history of spectacle usage for a few months and he discontinued. Immunization history, developmental history, and family history were not significant. He presented with CHP of right-sided face turn, and his facial symmetry was not disturbed. Ocular symmetry was disturbed due to outward deviation of right eye. On Hirschberg corneal reflex test, 45 degrees exotropia were present on near and far. On covering the left eye, we could observe inward deviation of right eye. On alternate cover test, both eyes moved briskly inwards. On prism bar cover test, for near and far, we observed 85 prism diopters base inwards in front of right eye and central in front of left eye. The versions and duction movements were full and free in both eyes. On Worth-4 dot testing and diplopia charting, we observed paradoxical diplopia. Since it's an exotropia, the diplopia out here, it's uncrossed diplopia, so we observed paradoxically. Vision was 6/6 in both eyes, and anterior segment findings were normal, and fundus was within normal limits. Investigations were within normal limits. You can observe here the pre-op photographs. On all 9 gazes, he had full and free movements. So we performed muscle transplantation surgery, right eye 11 mm lateral rectus recession and 7 mm medial rectus resection. So let me just show you this video. So in this procedure, the lateral rectus is hooked and it's isolated with a limbus based incision, and intermuscular septum is cut and a 5-0 double ethibond whip stitch suture is applied to the lateral rectus muscle. The medial rectus is now separated with a limbal based incision, and a 6-0 vicryl is passed through the tendinous insertion of the medial rectus muscle, and another 6-0 vicryl suture is then placed as per standard dissection procedure, and it is sutured to the sclera following the spiral of Tillot, and then the muscle is cut. Now the resected part is transplanted to the lateral rectus muscle. This is the resected part now. It will be transplanted to the lateral rectus muscle, and its distal end is united with the 5-0 ethibond suture. The proximal end of the resected part is anchored to sclera by a 6-0 vicryl, and thus the whole resected piece acts as a biological spacer. So on post-operative notes, we observed both eyes HCRT was central. You can observe this on post-operative day 1. Following treatment was given antibiotics and steroids. So post-operative day 1 week, day 7. Fortunately, within 1 to 2 weeks, patient responded well, and complaints of diplopia also resolved in the patient. So on conclusion, the adult onset exotropia associated with paradoxical diplopia was resolved in this patient with muscle transplantation surgery, which is a novel procedure. Thank you.